Mastitis is a common but serious health condition that affects goats, especially does in milk. Recognizing mastitis early and knowing how to respond can be the difference between a healthy herd and significant losses. Whether you're an experienced goat keeper or just starting your herd, understanding mastitis is crucial to your goat's well-being and your farm's productivity. So, what exactly is mastitis? Mastitis is an inflammation of the udder, typically caused by bacterial infection, though sometimes viruses, fungi, or physical injury play a role. This condition can present in both acute and subclinical forms. Acute mastitis comes on suddenly and is easier to spot, while subclinical mastitis might not show obvious signs but can silently impact milk quality and quantity. Let's start by identifying the signs of mastitis in goats. One of the earliest indicators is a change in the consistency, color, or taste of the milk. Healthy goat milk is smooth, white, and pleasant smelling. With mastitis, you might notice the milk becomes thick, clotted, or yellowish. Sometimes you'll see flakes, pus, or blood. The milk may also taste salty or unusually bitter. Next, examine the udder and teats. Gently feel the udder for any swelling, hardness, heat, or tenderness. The affected part of the udder may appear larger or feel firmer than normal. The goat may flinch, kick, or cry out when you touch the inflamed area. Pain is a frequent symptom. In severe cases, the skin over the udder may become reddened or even bluish, indicating reduced blood supply. Pay close attention to the goat's overall behavior. A doe with mastitis often shows signs of discomfort. She may be reluctant to walk, have a reduced appetite, or separate herself from the herd. Acute cases may also present with fever, rapid breathing, or lethargy. If left untreated, mastitis can quickly lead to serious illness, permanent udder damage, or even death. Now, let's discuss how you can confirm your diagnosis. While the signs we've discussed are strong indicators, laboratory testing is the only way to definitively identify mastitis and the organism that's causing it. A simple and effective farm-level test is the California Mastitis Test, or CMT. To use the CMT, squirt a few drops of milk from each half of the udder into the test paddle. Add the CMT reagent and swirl gently. If the milk thickens or gels, mastitis is present, often before clinical signs appear. For more precise identification, sending a milk sample to your veterinarian for bacterial culture and sensitivity testing is recommended. Understanding what causes mastitis can help you prevent it in the first place. The most common culprits are poor sanitation, injuries to the udder or teats, improper milking practices, and environmental stressors. Dirty bedding, rough milking equipment, or other animals stepping on the udder can all open the door for infection. Some breeds and individual goats are more prone to mastitis, especially high-producing dairy goats or those with pendulous udders. Once you've identified mastitis, prompt and effective treatment is essential. Treatment depends on the severity and cause of the infection. For mild cases, start by improving udder hygiene and milking frequently, at least every 4 hours, to remove infected milk and reduce bacterial load. Gently massage the udder to help loosen clots and keep the milk flowing. Make sure the goat is drinking plenty of water and eating well. For more serious cases, or if there's no visible improvement after 12 to 24 hours, it's time to step in with medication. The cornerstone of mastitis treatment is antibiotics, either systemic, by injection, or intramammary, directly into the udder through the teat canal. However, it's vital to consult your veterinarian before starting antibiotics, as only certain drugs are effective for mastitis, and improper use can worsen antibiotic resistance. Your vet can advise you on the correct drug, dosage, and withdrawal times to ensure milk and meat safety. In cases of severe pain or swelling, non-steroidal anti-inflammatory drugs like flunixin or meloxicam can help reduce discomfort and inflammation. Keeping the affected goat comfortable and stress-free will also aid the healing process. Throughout treatment, closely monitor your goat for signs of improvement. Milk should gradually return to normal consistency, and the udder's swelling and tenderness should decrease. Persistent or worsening symptoms require further veterinary intervention, as they may indicate abscess formation or gangrene, which can be life-threatening. It's equally important to protect the rest of your herd. Mastitis-causing bacteria can spread easily through contaminated hands, equipment, or bedding. Always wash your hands thoroughly before and after milking, and sanitize all milking equipment after each use. Consider milking affected goats last to prevent cross-contamination. Isolate goats showing signs of mastitis until you're sure they're well. Now let's discuss prevention, because prevention is always better than cure. Good milking hygiene is the foundation of mastitis control. Always clean and dry the udder and teats before milking. Use single-use paper towels or clean cloths for each goat to avoid passing bacteria from one udder to another. Make sure all milking equipment is cleaned and sanitized after every milking. If you use machine milking, check the equipment regularly for wear and tear, as cracks or leaks can harbor bacteria. Pay attention to bedding and shelter. Keep bedding clean and dry, replacing soiled straw or shavings frequently. A clean living environment dramatically reduces the risk of infection. Minimize stress by providing adequate space, shelter from weather extremes, and gentle handling. Nutrition is another key factor. A balanced diet rich in vitamins and minerals gives your goat's immune systems the strength to fight off infections. Ensure your herd has continual access to fresh, clean water and offer high-quality forage and minerals. If you're raising dairy goats, avoid sudden changes in feed or milking routines, which can stress the animals and make them more susceptible to illness. Finally, keep detailed health records. Track milk yields, udder health, and any signs of illness. By spotting changes quickly, you'll intervene early, often before a mild infection becomes a serious outbreak. To sum up, mastitis is a common challenge for goat keepers, but with vigilance, good management, and timely treatment, it can be controlled. Watch for changes in milk and udder appearance, respond quickly to any signs of infection, and maintain strict hygiene and animal care standards. By knowing what to look for and acting fast, you'll keep your goats healthy, your milk production strong, and your herd thriving for years to come.